Introduction. Hello and welcome to our YouTube channel. In this video, we'll be discussing the field of anesthesiology. The different types of anesthesia. General anesthesia. General anesthesia is a type of anesthesia that causes a complete loss of consciousness and sensation. It is used during major surgical procedures or other medical procedures that require a patient to be completely unconscious. During general anesthesia, a patient is given a combination of medications that are designed to put them into a deep sleep. These medications can be administered through an intravenous line, by inhalation, or by injection. Once the patient is unconscious, the anesthesiologist will carefully monitor their vital signs, such as heart rate, blood pressure, and breathing, to ensure that they remain stable throughout the procedure. After the procedure is completed, the anesthesiologist will gradually reduce the medications, allowing the patient to wake up. The process of waking up from general anesthesia can take anywhere from a few minutes to a few hours, depending on the individual patient and the type of medication used. General anesthesia is a safe and effective way to provide pain relief and unconsciousness during major surgical procedures. However, as with any medical procedure, there are potential risks and complications that should be discussed with an anesthesiologist before undergoing general anesthesia. Regional anesthesia. Regional anesthesia is a type of anesthesia that numbs a specific area of the body. It is often used for surgical procedures or other medical procedures that require only a specific area of the body to be numb. There are several different types of regional anesthesia, including spinal anesthesia, epidural anesthesia, and peripheral nerve blocks. Spinal anesthesia is injected into the spinal fluid, causing numbness from the waist down, and it's often used for surgeries on the lower half of the body like cesarean delivery or knee replacement. Epidural anesthesia is similar to spinal anesthesia but is injected into the space outside the spinal cord, rather than directly into the spinal fluid, and is often used for surgeries on the lower half of the body like cesarean delivery or hip replacement. Peripheral nerve blocks are a type of regional anesthesia that numb a specific nerve or group of nerves, and it's often used for surgeries on the hand, arm, foot, or leg. Regional anesthesia is a safe and effective way to provide pain relief and numbness during surgical procedures or other medical procedures, but like any medical procedure, there are potential risks and complications that should be discussed with an anesthesiologist before undergoing regional anesthesia. Local anesthesia. Local anesthesia is a type of anesthesia that numbs a specific area of the body. It is often used during minor surgical procedures or other medical procedures that only require a small area of the body to be numb. Local anesthesia is typically administered through an injection, either directly into the skin or into a specific nerve or tissue. The medication numbs the area, providing pain relief during the procedure. Local anesthesia is a safe and effective way to provide pain relief during minor surgical procedures or other medical procedures. However, as with any medical procedure, there are potential risks and complications that should be discussed with an anesthesiologist or healthcare provider before undergoing local anesthesia. Monitored anesthesia care, MAC. Monitored anesthesia care, or MAC, is a type of anesthesia that involves the use of sedation and pain management during a medical procedure. It is often used for procedures that do not require a patient to be completely unconscious, such as endoscopies or minor surgical procedures. During MAC, an anesthesiologist administers a combination of medications through an intravenous line to help the patient relax and manage pain. The anesthesiologist will carefully monitor the patient's vital signs and adjust the medications as needed to ensure the patient remains comfortable throughout the procedure. While the patient is under MAC, they will typically be awake, but may be drowsy or groggy. They may also be given a local anesthetic to numb the specific area being treated. Monitored anesthesia care is a safe and effective way to provide sedation and pain management during medical procedures. However, as with any medical procedure, there are potential risks and complications that should be discussed with an anesthesiologist or healthcare provider before undergoing MAC. The role of the anesthesiologist. Anesthesiologists are medical doctors who specialize in the administration of anesthesia and the management of pain. They play a vital role in ensuring the safety and comfort of patients during medical procedures. The role of the anesthesiologist begins before the actual procedure. During the pre-operative evaluation, the anesthesiologist will review the patient's medical history and conduct a physical examination to determine the best type of anesthesia for the patient. They will also discuss the risks and benefits of the different types of anesthesia with the patient. During the actual procedure, the anesthesiologist will administer the appropriate type of anesthesia and carefully monitor the patient's vital signs, such as heart rate, blood pressure, and breathing. They will also adjust the anesthetic medications as needed to ensure the patient remains comfortable and safe throughout the procedure. After the procedure is completed, the anesthesiologist will help the patient recover from the anesthesia, including managing any pain or discomfort. The role of the anesthesiologist is essential in ensuring the safety and comfort of patients during medical procedures. They work closely with the surgical team and other healthcare providers to provide the best possible care for their patients. Pre-operative evaluation. Pre-operative evaluation is an important step in the preparation for a surgical or other medical procedure. It's typically conducted by an anesthesiologist, but can also be done by a nurse anesthetist or other healthcare provider. The evaluation includes reviewing the patient's medical history, conduct a physical examination, identify potential risks or concerns related to the administration of anesthesia. The anesthesiologist or healthcare provider will ask the patient questions about their medical history, including any previous surgeries or hospitalizations, any underlying medical conditions, such as heart disease or diabetes, any allergies or sensitivities to medications, and any current medications or supplements they are taking. They will also review the patient's current and past use of nicotine, alcohol, or other substances that can affect the administration of anesthesia. The anesthesiologist will conduct a physical examination, check the patient's vital signs and lung function, and assess the patient's ability to tolerate the procedure under different types of anesthesia. They will also explain the different types of anesthesia that are available and the risks and benefits of each, and will work with the patient to determine the best type of anesthesia for the particular case. The pre-operative evaluation helps the anesthesiologist to identify any potential risks and tailor the anesthesia plan to meet the specific needs of the patient, ensuring safety and comfort of the patient during the procedure. Administration of anesthesia. The type of anesthesia administered will depend on the specific needs of the patient and the type of procedure being performed. For example, a patient undergoing a major surgical procedure will typically receive general anesthesia, while a patient undergoing a minor surgical procedure may receive a regional or local anesthesia. General anesthesia is a combination of medications that put the patient into a deep sleep. It's administered through an intravenous line, and the anesthesiologist will carefully monitor the patient's vital signs to ensure that they remain stable throughout the procedure. Regional anesthesia is a type of anesthesia that numbs a specific area of the body, usually administered by an injection in the spinal cord or epidural space, and the anesthesiologist will monitor the patient's vital signs, level of consciousness, and sensation. Local anesthesia is a medication given by injection directly into the area that will be numbed during the procedure, such as the skin or a specific nerve. The administration of anesthesia is a critical step in ensuring the safety and comfort of the patient during the procedure. The anesthesiologist will adjust the medications as needed throughout the procedure to ensure that the patient remains comfortable and safe. Monitoring vital signs during surgery. An important aspect of anesthesiology is the monitoring of a patient's vital signs during a surgical procedure. This includes monitoring things such as heart rate, blood pressure, breathing, oxygen levels, and body temperature. These vital signs are critical indicators of a patient's well-being and can help the anesthesiologist to identify and respond to any potential issues during the procedure. During surgery, the anesthesiologist will use various monitoring equipment, such as electrocardiogram, ECG, machines, blood pressure monitors, and pulse oximeters, to track the patient's vital signs. These devices will be attached to the patient before the procedure begins and will be monitored throughout the procedure to ensure that the patient's vital signs remain stable and within normal range. The anesthesiologist will also assess the patient's level of consciousness and pain, and adjust the anesthesia as needed to ensure that the patient remains comfortable during the procedure. In case of any abnormal vital signs, the anesthesiologist will take immediate action to correct it. This could include adjusting the anesthetic medications, providing additional oxygen, or other interventions to ensure the patient's safety. In addition to monitoring the patient's vital signs, the anesthesiologist will also closely monitor the patient's airway, which is important since it can affect the patient's ability to breathe during the procedure, and will have a plan for airway management during the procedure. Pain management. Pain management is an important aspect of anesthesiology and patient care. During a surgical procedure or other medical procedure, patients may experience varying levels of pain, both during and after the procedure. It is the responsibility of the anesthesiologist and other healthcare providers to manage the patient's pain and provide relief. There are a variety of methods for managing pain, which can be used alone or in combination, depending on the needs of the patient. These methods include 1. Analgesic medications. These are medications that are used to relieve pain. 1. They include over-the-counter pain relievers, such as ibuprofen and acetaminophen, as well as prescription pain medications, such as opioids. 2. Regional anesthesia. This is a type of anesthesia that numbs a specific area of the body. 2. It can be used to provide pain relief during a procedure and can also be used to provide pain relief after the procedure. 3. Nerve blocks. These are injections of anesthetic medication that are used to numb a specific nerve or group of nerves. 3. They can be used to provide pain relief during a procedure and can also be used to provide pain relief after the procedure. 4. Acupuncture and acupressure. These are alternative therapies that have been used for centuries to manage pain. 4. They involve the use of needles or pressure applied to specific points on the body to relieve pain. 5. Physical therapy. This includes various techniques such as exercise and manual therapy which can help to reduce pain and improve function. It is important to note that the most appropriate pain management method will depend on the individual patient, the type of procedure and surgery, and other factors. Anesthesiologists will work closely with other healthcare providers to develop a pain management plan that is tailored to meet the specific needs of the patient. Complications of anesthesia. Anesthesia is generally a safe and effective way to provide pain relief and numbness during surgical and other medical procedures. However, as with any medical treatment, there is a small risk of complications. Some of the most common complications that can occur with the administration of anesthesia include 1. Nausea and vomiting. Some patients may experience nausea and vomiting following the administration of anesthesia. This is usually temporary and can be treated with medication. 2. Sore throat. Some patients may experience a sore throat following the administration of anesthesia. This is typically caused by the breathing tube that is inserted during certain types of anesthesia, such as general anesthesia. 3. Allergic reactions. Rarely, some patients may have an allergic reaction to the medications used during anesthesia. This can include symptoms such as hives, itching, and difficulty breathing. 4. Blood pressure changes. Some patients may experience changes in their blood pressure during or after the administration of anesthesia. This can be caused by the medications used during anesthesia or by the stress of the procedure. 5. Breathing problems. Some patients may experience breathing problems during or after the administration of anesthesia. This can be caused by the medications used during anesthesia or by an obstruction in the airway. 6. Wound infection. As with any surgical procedure, there is a small risk of infection, which may occur at the surgical incision site. Thank you for watching, and stay tuned for more videos on anesthesiology and related topics.